Let's jump to page 41. All right, so this is page 41. And it says the effect of the, and all of you who've had chemistry know that when you put a chemical in brackets, that means concentration of. So the effect of the concentration of potassium in the extracellular fluids, like blood, on the resting cell membrane potential. This is exactly what we were setting up. So we're going to tell you first about the effects of hypokalemia. What does hypokalemia mean? Well, the symbol for potassium is K. That's because the actual Greek word for potassium is kalium. So hypo means low, kalemia, kalium means potassium, K, and emia means in the blood. So there's a low potassium in the blood and other extracellular fluids because they're all chemically similar. Don't confuse hypokalemia with hypocalcemia. Do you think anybody has ever done that? Sure, because these are two very different chemicals and what they do in the body. Don't confuse potassium with calcium. These are different. Now, we're going to be talking about what happens. But before we do, let's make this more clinically relevant. Let's address why would somebody ever even develop hypokalemia? Why would it happen? Now, if you're in a nursing program, you're going to learn about 20 different things. I'm going to give you 4. I'm going to give you 4 things. There's a lot more than 4 things that can cause low potassium in the blood and body fluids. The first one, inadequate intake of potassium. All right? Does that make sense? If you're not getting enough potassium, maybe you're going to have abnormally low potassium levels in your blood. Now, let me tell you this. Even if you eat absolutely the worst diet, you will still get plenty of potassium. In fact, there's actually a lot of potassium in even a junk food diet. So who develops low potassium because they're not getting enough? Anorexics and bulimics. Somebody who has anorexia means they don't eat. That's not eating a bad diet. That's not eating. So then you can have low potassium depletion. Bulimia is where somebody eats and then they force themselves to vomit it up. So these result in potassium depletion of the potassium in the body and low potassium levels. All right, now, another possible cause of low potassium is the use of most diuretics. Now, what are diuretics? Diuretics are commonly called water pills. I don't like that term, but they'll call them water pills. A diuretic makes you pee. All right, now the fancy way of saying they make you pee, they make you urinate, is they increase urine output. So people who are on diuretics, they increase the amount of how much they urinate. Now, all the diuretics increase the amount of salt and water you excrete. They all do that. And most diuretics, not all, but most diuretics not only cause your kidneys to excrete excess water and salt, but also increase excretion of potassium. Now, most people who are getting diuretics, we want them to get rid of the salt and fluid in their body. We don't necessarily want them to lose potassium, but they may. Now, just to explain a little bit further about why somebody was given diuretics, well, if diuretics make you excrete all this fluid and salt and stuff like that, they give it to people with edema. What's edema? Swelling. Edema is swelling. So anybody who's got a lot of buildup of fluid anywhere in their body or everywhere in their body is placed on diuretics. Now, the most common people who have swelling are people with high blood pressure. Everybody with high blood pressure has edema. Now, where you especially tend to notice is around the ankles because of gravity. So almost everybody, 80% of people with high blood pressure are on a diuretic drug. 80% of them. Okay, they're different categories of diuretics. You can see how clinical we get in physiology, exactly what's going on. So there's a lot of other reasons why somebody might have edema or swelling and placed on diuretics. Most common, though, is high blood pressure, and they've got edema. We want to get rid of this excess fluid and stuff. So that can cause people on diuretics may start to develop hypokalemia and have potassium depletion. And that's why many people who are on these diuretics, they actually tell them either take potassium supplements, and they'll prescribe them. Has anybody ever heard of that? Where they prescribe potassium supplements, or they just tell them to eat foods high in potassium. And the foods that are good in high in potassium are like bananas. Okay, cranberry juice has got potassium. Almonds are a good source of potassium. But bananas are everybody's favorite, unless you don't like bananas. Most people like bananas. All right, now, another possible cause is hyperaldosteronism. Now, don't worry too much about this for right now, but I'll tell you what this is. We had learned, and you do need to know this for the test on Tuesday, when we reviewed steroid hormones, we mentioned 3 categories of hormones secreted by your adrenal gland. Adrenoandrogen, or DHEA. We talked about mineralocorticoids and glucocorticoids. The mineralocorticoids are the hormones that control your sodium and potassium electrolyte levels. And the most important of those mineralocorticoids is called aldosterone. And so if you actually have too much of this hormone, it actually causes your kidneys to excrete excessive amounts of potassium. Now don't worry about remembering that detail now, because we're going to learn a hell of a lot more about this hormone when we get to endocrinology. This of course builds. So, but this is, just know that if you have a hormonal imbalance in the hormone that regulates your sodium and potassium levels, that can lead to hypokalemia. Now, a fourth possible cause, and there are more, is excessive vomiting or diarrhea, especially in infants. Okay? Now, this can happen in adults as well who have excessive vomiting or diarrhea, but it's most commonly observed in infants. Now, how would that cause low potassium levels? Why don't you go back to page A2. Page A2. On the bottom of A2, there's a schematic drawing of the body. And you look at the alimentary canal. Notice there is a solid black arrow pointing from the alimentary canal to the bloodstream. And there's also a dashed arrow pointing from the bloodstream back to the alimentary canal. That means that not only what's in your alimentary canal can be absorbed into your bloodstream, it also means what's in your bloodstream can go back out into the alimentary canal. So we see this especially in infants. When they're sick, and they may be vomiting for a couple of days, few days, or diarrhea for a few days, or both, and they're not able to keep any food down. So they keep vomiting. They keep vomiting or pooping or something, and we wonder, where's all that fluid coming from that they keep vomiting out? It's coming out of their bloodstream. Their blood volume is dropping, and also their electrolyte levels in their bloodstream are dropping, both sodium and, more importantly, potassium. So, of course, any mother who's had a sick child who has been too ill to eat, to drink milk or eat food, they call the pediatrician, and the pediatrician says, oh, Pedialyte. Everybody has heard of Pedialyte who has a kid. The Pedialyte is like Gatorade or Powerade for infants. So just like Gatorade or Powerade, which people take when they're sweating a lot, exercising and sweating, when you sweat, you also drop your blood volume and lose electrolytes. We mentioned that before back on page A3. So that's why we said you can see a drop in blood pressure if you sweat too much, because of a drop in blood volume and lose electrolytes. So Pedialyte provides fluid for that infant, provides sugar for that infant, and most importantly, it provides electrolytes for that infant, and the most important one of all the electrolytes is potassium. So they can develop, if you don't do this, they will develop hypokalemia, which we'll see what that does. All right, we've given you 4 examples so that you understand that there are many things that can clinically cause this condition. There are more than this. Let's see what the consequences then of hypokalemia are. So we know that as long as the concentration of potassium is 150 milliequivalents per liter on the inside and 5 milliequivalents per liter on the outside, the voltage in the cell is about minus 90 millivolts, and everything is said to be in the equilibrium state. Now let's imagine that because of any of these examples I've given you, the potassium level in the blood and extracellular fluids is starting to go down. Right? Because either the person's not eating enough foods with potassium, or they've got on a diuretic that's causing them to excrete potassium out of their bloodstream into their urine, or they're vomiting out the potassium. As the potassium level starts to drop from 5 to 4.5, from 4.5 down to 4, from 4 down to 3.5, from 3.5 down to 3, as the extracellular potassium level is dropping, now we're increasing the concentration gradient. Remember, we've learned that the bigger the difference in concentration, the faster the rate of diffusion. As long as there was 5 out here, there was no more potassium going out. But if it starts to decrease, become less than 5, potassium start flowing out of the cell. And as the positive charged potassium start flowing out of the cell because of the lowering of the potassium level, what does that do to the electrical polarity on the inside of the cell? It makes it more negative. So we wrote that right here. A decreasing potassium ion concentration in the extracellular fluids increases the diffusion of potassium out of the cell, causing the membrane potential to become even more negative than normal. So it starts to go from minus 90 to minus 95 to minus 100 to minus 105. This is called hyperpolarized. It's becoming more negative than normal. So we're thinking, okay, so what? What is that going to do? So the clinical symptoms, the manifestations are this. The more negatively polarized all the cells in your body become, it causes a slowing down of all activity in the entire body. Everything slows down. There's a slowing of electrical activity in the brain, a slowing of muscular activity, a slowing of GI motility. Everything slows down. All right? So this is when we see a slowing and weak heart rate, a fatigue, a decrease in activity. The person with hypokalemia becomes really weak. Their heart rate slows down, their blood pressure drops, it's difficult to stay awake. Everything is slowing down in their entire body. In the case of that little infant, instead of the infant being active, well, at least when it's awake and hitting its rattle or whatever, it's just lying there, looking very difficult as if to breathe, just looking like it's having tremendous difficulty breathing. It's breathing very slowly. Its heart rate is slower than normal, and it's not moving. The baby is not moving. It's just lying there. That's hypokalemia. Everything has slowed down. Now, the good news is it's easily fixed. In the case of that infant, give them Pedialyte. If you've lost potassium and electrolytes from sweating, drink some Gatorade or Powerade. Eat a banana. Now, if it's more serious, in the hospital setting, so then they're going to give you this, potassium chloride. And that's going to raise the potassium levels. And as you raise the potassium, as the potassium levels start to go up in the blood and extracellular fluid, that will drive positive charged potassiums into the cell, making the inside less negative again and returning it back to the normal electrical polarity of about minus 90. The beauty of physiology and medicine is the symmetry. If you understand hypokalemia, which we've been talking about, hyperkalemia is just the opposite. Everything that we've said is just the reverse. Let's look at the effects of hyperkalemia. Now, again, we know that as long as the normal levels of potassium are 150 milliequivalents per liter on the inside, 5 on the outside, including in the blood, everything is in an equilibrium state. Everything's just staying that way. But let's imagine the extracellular potassium, the potassium levels in the blood and extracellular fluid, for whatever reason, and I will give you reasons in a moment, started to increase. So it's going from 4 to 4.5, 4.5 to 5, 5 to 5.5, 5.5 to 6, 6 to 6.5, 6.5 to 7. It's rising. As the increasing potassium increases on the outside of the cell, that's going to cause, that's basically changing these concentration gradients, and potassiums are going to start to flow in. And as positive charged potassium start to go into the cell, it's making the inside less negative than normal. So instead of the cell being minus 90, it's going to become minus 85, minus 80, minus 75, minus 70, minus 65, minus 60. It's becoming less negative. So we wrote at the bottom, hyperkalemia, increased potassium in the extracellular fluid increases the diffusion of potassium into the cell, causing the membrane potential to become less negatively polarized than normal. Less negative. And that term we use is depolarized. Now, on page 42, you'd say, okay, fine, so what's going to happen if all the cells in our body start to become less negatively polarized than normal? And the answer is just the opposite of what happened with hypokalemia, where all the cells were becoming more negatively polarized than normal. In the first case, everything slowed down. So in this case, everything speeds up faster and faster and faster and faster and faster. It gets faster and faster. It's just the reverse. So what happens in hyperkalemia is an increase in electrical activity in the nervous system, increase in electrical activity in the brain causing seizures, increase in electrical activity in the skeletal muscles and twitches, increase in electrical activity in the heart rate starts speeding up faster and faster and faster. It goes into a flutter and fibrillation, and the heart starts fibrillating and the person dies. When you affect the electrical voltage of all the cells in the body, this is how it's affecting. So these are massive effects on the body just because of potassium. You can see why potassium is the most important mineral or electrolyte in the body. So we wrote generalized stimulation, overstimulation of the nervous system and muscles, manifested by irritability, twitches, heart flutters, fibrillations, increased GI motility, everything is speeding up. Now, what would cause hyperkalemia? So I'll give you a few examples. Again, there are many reasons. We'll give you 3. One of the most common causes of hyperkalemia is kidney failure. Let me put it this way. I have a question for you. Why isn't there a warning label on every banana? Why isn't there a warning label, do not exceed more than 4 bananas? If bananas have potassium, then how come if you don't, let's say you said, I'm going to have 4, 5, 6 bananas, why don't you all develop hyperkalemia?
It's not going to acclimate.
Because your kidneys, one of their jobs is to excrete the excess potassium. We learned back on page A3, when we were reviewing the systems of the body, we said your kidneys, your urinary, your renal system's job is to excrete excess water, excess salts, including electrolytes like potassium, and waste products out of your bloodstream. As long as your kidneys are healthy and working, you can eat all the bananas you want, normally, because any excess potassium you eat from your bananas, your kidneys will just excrete it out. But wait a second, what if your kidneys don't work? Then, eating those bananas is going to raise that potassium level, and you will develop hyperkalemia. All right, so people with kidney problems do tend to develop potassium imbalances. Now, another possible cause is excessive IV administration of potassium. So when you're dripping potassium into the bloodstream in a hospital setting, if you give too much of it, that's hyperkalemia. Now, I'll take just a moment to tell you of an old episode of ER. And they couldn't stop the fibrillation, and within a matter of minutes, you got a dead patient. And they were trying to figure out, the patient came in and they were fine, they just were dehydrated, they just needed some saline, and then one of the doctors noticed, that the nurse, the retiring nurse who was supposed to give sodium chloride, saline, had given potassium chloride. Now, for most people to say sodium chloride, potassium chloride, it's not a big deal. It's one letter difference, KCl, NaCl, big deal. It makes all the difference in the world. It created hyperkalemia, and we just went through and told you it's going to speed up all the activity in the body, causing fibrillation. The defibrillator cannot correct that. Now, another possible cause is, you remember that hormone, aldosterone, that controls the sodium and potassium levels? Just as too much of that hormone leads to hypokalemia, too little of the hormone leads to hyperkalemia. Again, don't worry about which one direction it goes in. Later we're going to learn a lot more about what is technically known as the renin-angiotensin-aldosterone reflex. But we'll get into that, if anybody's ever heard of the renin-angiotensin-aldosterone reflex. So that's the hormone. If it's out of balance, then the sodium and potassium levels are out of balance. Now, how do you treat it? This is much more complicated. With hypokalemia, it's really easy to treat. Give them a banana to eat. Give them potassium. Give them Pedialyte. That solves the problem. In this case, there's too much potassium in their body. How do you get the potassium out? There's too much potassium in their body, in their bloodstream. How do you get it out? This is very difficult, much more difficult to treat. If you've got the time, if their heart isn't going into fibrillation, because if it's in fibrillation, you've got just a matter of seconds, minutes, to save them. If their body's just speeding up, and it's not yet in that critical state, first, you could try giving them diuretics. Didn't we learn that many diuretics cause the kidneys to excrete not only salt and water, but potassium? That'll lower the potassium in their bloodstream by giving them a diuretic, not in this case to get rid of edema, but to get rid of the excess potassium. That's going to take a while, though. So if their heart's already in fibrillation, that's not going to take too long to work. Another thing they can do is to give something called an ion exchange resin. An example of that is called Kayexalate. I'm not asking you to know the name of this stuff. Has anybody ever heard of it? Anybody? Okay, what the hell is Kayexalate? What is an ion exchange resin? The K stands for potassium. Exalate is supposed to remind you of the word chelate. Chelate means to bind. Now, we have told you on that picture on the bottom of A2, not only what's in the alimentary canal can be absorbed into the bloodstream, but what's in the bloodstream can go back out into the alimentary canal. What this ion exchange resin, or Kayexalate, does, you swallow it. It's like a jello. You swallow it, and when it's in the intestine, it draws potassium out of the bloodstream into the alimentary canal. It chelates, it binds, it attracts potassium specifically from the bloodstream into this jello. And you poop it out. And so, again, this is going to take hours to move through the digestive tract, but you expel out the feces, the stool, this jelly-like stuff, which is grabbed onto a bunch of excess potassium out of your bloodstream. Another approach is to put the patient on hemodialysis. That's an artificial kidney machine. That's certainly appropriate if the reason why they developed hyperkalemia is because of kidney failure. If you know of anybody who has kidney failure, you know that every other day they have to spend about 3 hours in a dialysis center. Does anybody know about that? So how does that work? They actually have a plastic shunt, a U-shaped shunt in their arm, right about here. They connect them up to a machine. The blood starts flowing from their artery through this artificial kidney machine, and then it comes back into their vein. And that machine tries to do the job of what kidneys do. It filters out the excess water, the excess salts, including potassium, and the waste products. And you have to be on that machine for a number of hours every other day to filter out enough of this stuff just so you don't die. Anybody who needs to be on a dialysis machine, believe me, wants a kidney transplant, because they don't like living their life where every other day they have to spend 3-4 hours on a machine, right, in order to live and not die. So, but again, this will help, this will get rid of the potassium, but it's going to take some hours to work. So you got to have that time. If it's an emergency, the only thing that sometimes works is to give a drug called calcium gluconate. I am not going to explain how that works. It has to do with affecting calcium, affecting ion channels with calcium, but I'm not going to get to that. All right, so I think you can see that while we're learning physiology, I'm trying to show you clinically how this all plays out. Now, let's summarize what we've learned. We use graphs to summarize a concept. So, we're going to get really good at reading graphs, as I told you. First thing we do is we see what's plotted on the graph. On the x-axis is the concentration of potassium in the blood and other extracellular fluids in milliequivalents per liter. So it's got like 1 milliequivalent per liter, 2.5 milliequivalents per liter, 5 milliequivalents per liter, 10 milliequivalents per liter, 20 milliequivalents per liter. All right, and then what's on the y-axis? On the y-axis is the membrane potential in millivolts, the voltage of the cells. Because potassium determines the voltage of all the cells in the body. So, what's a normal potassium concentration in our blood and other extracellular fluids? 5. It's 5 milliequivalents per liter. So, you'll notice that there's a graph line. This graph line shows the relationship between the potassium ion concentration and the electrical voltage. And this graph line is beautiful. Why is it beautiful? Because it's linear. What does linear mean? It's a straight line. That makes it really simple, mathematically. So, if the potassium level is 5 milliequivalents per liter in the blood, which it normally would be, approximately, draw a line up to where it hits the graph line, then draw a horizontal line to your left, and that tells us that the voltage, if the potassium level in the blood and extracellular fluids is 5 milliequivalents per liter, the voltage is about, 85, 90 millivolts. Okay, somewhere like around there, 85, 90 millivolts, whatever it is. The way they actually determine that, all this is with the Nernst equation. This is really just plugging in different extracellular potassiums into the Nernst equation. All right, now, what if the potassium level dropped to 2.5 milliequivalents per liter? That's called hypokalemia. Let's see what happens. We'll draw a line from 2.5 to where it hits the graph line, draw a horizontal line to the left, and you'll notice the voltage now is not minus 85 or minus 90, it's now minus 105. Minus 105, 110. So, we would say it's more negative than normal. It's hyperpolarized. It's more negative. What does that do? It causes a slowing down of all electrical activity in the body. Conversely, if the potassium level rises to 10, and if it's 10, you're already dead. But if it rises to 10, draw a line up to where it hits the graph line, draw a horizontal to the left. You'd say, why are we starting here and going to there? This is called the independent variable. This is the dependent variable. The potassium levels determine the voltage. The voltage doesn't determine the potassium determines the voltage. So, when the potassium level reaches 10, the voltage in the cell is about minus 70. Minus 70 is less negative than normal, minus 90. The term we use is it's depolarized. It's less negative than normal. All the cells are depolarized. What does it mean when all the cells are depolarized? Overall increase in electrical activity throughout the entire body. Everything's faster than normal. All right, so that's the summary of how potassium levels affect the electrical voltage of cells.